There's two types of bedpans you should be familiar with, okay? You have the fractured pan, okay? And you have this regular pan. Okay. Anybody? All right, when you have the bedpan, this is what you'll use for the patient who cannot get up and walk or ambulate, and you help them to defecate or urinate within this. You would, of course, again, lift the bed in the comfortable position for yourself. Turn the patient. You can either apply this two ways. Either you have the patient turn to one side, the opposite side, and of course you would have the side roll up, or if the patient is able to, you would ask them to lift up, right? Some will have like what's called like a trapeze bar up overhead, and they can lift up, and then that actually makes it easier for you to just slide it underneath. Now what you'll see too, what some CNAs will do, they'll put like a mini check over this like so, and then slide. Some will actually put powders. I've seen that, but you want to refrain from putting powders, and especially talc, TALC powder, because that can potentially cause harm to the skin. We're going to lower the head of the bed. The client gave me permission, and they have no pain or allergies. We're going to turn you to the side so we can apply the bedpan so you can defecate and urinate comfortably. Bree is going to help turn, and you're going to do that by pulling on this chuck. Okay, turn the client. I'm going to now take the chuck away from her. She's going to hold the patient, and then we're going to now apply. Okay, so apply where they actually feel comfortable to do what they need to do. Okay. All right, and if you notice, patient is on the bedpan comfortably. If you have the head of the bed down, put the head of the bed back up. Because you do not use the toilet lying down, do you? Right? So it defeats the purpose of actually eliminating the way you need to. You allow the patient to do what they have to do, and then give them privacy, provide privacy, and then of course you will put the call bell within reach. When you know that you have the client on a bedpan, let's say it's been 10 minutes or so that they have not called you back, you are going back to check on that patient. This bedpan is not supposed to stay for hours on end. No, 30 minutes is even too much. That pressure from sitting on this bedpan will jeopardize the integrity of the skin, especially in the sacral area. And then you're gonna have another can of worm to be dealing with. Removing the bedpan is simple as well, but you wanna kind of hold it so it does not fall, okay? So Bree's going to go ahead and turn the patient to the side. Well, we're gonna turn the patient this way, and I'm gonna hold it down, okay? And then remove. Provide perineal care. Ask the patient if they're comfortable. They are comfortable. Cover them back up. And then I will go ahead and lower the bed and dispose of the content, people. Do not leave urine or fecal matter on the side table. Dispose of it in the toilet, and then clean it if you want to, or if you don't want to clean it, then dispose of it in a red biohazard bag.